1 out of 5 women in India suffer from polycystic ovary syndrome. PCOS affects millions of women of reproductive age in India and is the leading cause of infertility. Hi, I'm Sania Mirza, and I take privilege to welcome Dr. Babita, a renowned health expert who will offer practical strategies to empower women in managing PCOS complications. Raising awareness about PCOS can greatly benefit women due to the numerous myths and misconceptions surrounding the condition. Doctor, can you enlighten us on how a balanced portion control meal can positively impact a PCOS patient?
Thank you, Sanya. Obesity is the most commonly associated with PCOS, and we have seen that around 40 to 80% women of PCOS are obese. That's why the dietary modification is the mainstay and cornerstone of this management of PCOS. The balanced diet is very important and for weight reduction. We have to tell the girls not to do dieting by cutting your meal, because they cannot cut off their meal, because hunger will be there and then they will again take more and more food. So we have to tell them to shift your meal, shift your the food to a balanced food, that is a protein and multivitamin rich food. And with this diet, if we cut off the carbohydrates and we increase the protein and multivitamin, the weight reduction will be there in PCOS cases, and it will be very helpful, but it will work little bit late. But when it will work, then there will be no medication required. So that's why weight reduction and dietary modification is very important. Balanced diet, we all know what is balanced diet. This is really very difficult to explain for the general public what is balanced diet. They are thinking that what we are taking in our house or home, that is good diet, that is balanced diet, but that is not protein rich diet, that is carbohydrate rich diet, and that is made for a person who is actually working physically, but not for the person who are actually working by sitting or by standing only in the kitchen. So that's why you have to do workout, also the exercise and the balanced diet to reduce the weight. And with this treatment, many girls, they are actually improving with their body weight and also improving in their other symptoms like acne, hair fall, pimples, and also some ladies, they are conceiving also. Those who are struggling for the conception, they are getting conceived with this treatment. So this is the cornerstone, I would say that. Thank you.
Thanks, doctor. Can you also share how crucial is physical activity in the management of PCOS?
Very relevant question, Tanya. In PCOS cases, when only 5% of weight reduction will be there, then the hormonal milieu are actually changing and it is coming to favorable milieu. So, in what we have seen in PCOS cases, actually the insulin resistance is there. That's why there is obesity. That's why there is chance of diabetes is also there, and that's why there is hormonal imbalance. And also we have seen that there is hyperandrogenism, that means acne, that is due to the increase in the male hormone in the female body. So all this we will tackle it with the physical activity. When we do physical activity, there will be muscle uptake of the insulin, glucose by insulin, and insulin is sensitized, and that's why there is weight reduction and also the hormone is balanced. That means the acne, hirsutism, that will be decreased, the obesity will be decreased, and finally when we see the picture of the PCOS, then that will be also reduced, and we can see the good result and good energy level is also good, and also the hormonal milieu, that will be balanced. So it is suggested that in many studies 150 minutes of exercise per week, that means 30 minutes to 45 minutes exercise per day, only for 5 days per week. You can spare 2 days for yourself, so that will suffice the PCOS protocol of physical activity, exercise. Thank you.
Thanks, doctor. One more question. What are the important parameters to be regularly monitored in PCOS patients?
Constant monitoring of PCOS patient is very important because PCOS means it is polycystic ovarian syndrome, and that is a syndrome, not a single disease. It is not a disease of only ovary. It is including the hormonal milieu and the endocrine, that is the insulin and all other hormones of our body, and it is deranging all these things. So we have to be constantly monitoring these patients for, because they are high risk for also diabetes and uterine cancer, infertility, and also even if they conceived, there is chance of miscarriage. So these are the things that we have to tell them, and also continuous monitoring of their body mass index, blood pressure, then blood sugar level, and ovulation also is very important when it is occurring, because it is not that ovulation will not occur, that will occur, but maybe late occur, or it may not occur, anovulation can occur. So in these cases, depression and anxiety are also very important signs that we have to look for them. Then in pregnancy, there is chance of gestational diabetes, that we say GDM, that is the gestational diabetes mellitus. So in pregnancy also they have to maintain their diet and exercise so that there will be less chance of GDM. There is also increased chance of cardiovascular diseases, like there may be chance of hypercholesterolemia, block, all these things, that is heart related problems. So we have to be very conscious about all these things, and also we should say the girls and the ladies that you have to maintain your diet, because it is not only about the fertility or menstrual cycle, it is about all of your body, and in future also you are very prone for many diseases. So thank you, Sania.
Doctor, the clear message for all women is that meal, movement and monitoring are pivotal in managing PCOS for the benefit of women and society at large. Thank you, Dr. Babita, for your valuable insights which can be vital for effective management of PCOS. As an athlete myself, I recognize the importance of lifestyle management for a healthier tomorrow. Together, we can break the stigma, spread awareness, and support each other in this journey towards better health and well-being.